Good day, I am Ricardo Pascal, PS3F, and I'll be demonstrating on how to administer oxygen by nasal cannula. For the goal, the patient exhibits an oxygen saturation levels within acceptable parameters. For the equipment, check for oxygen delivery devices as ordered by healthcare provider. Oxygen tubing, consider extension tubing, and humidifier if indicated, sterile water for humidifier, and oxygen source, oxygen flow meter, appropriate room signs such as no smoking. For the implementation, bring necessary equipment to the bedside stand or over bed table. Next is to perform hand hygiene and put on PPE if indicated. Next is to identify the patient, close the curtains around the bed, and close the door to the room if possible. Next is explain what you are going to do and the reason for doing it to the patient. Next is to review the safety precautions necessary when oxygen is in use. Place the no smoking sign in appropriate areas. Then next is to connect the nasal cannula to oxygen setup with humidification if one is in use, and adjust the flow rate as ordered. Check that the oxygen is flowing and out of prongs, and place the prongs in patient's nostrils. Place the tubing over and behind each ear with adjusters comfortably under chin, and alternately the tubing may be placed around the patient's head with the adjuster at the back or base of the head. Next is to place the gauze pads at ear beneath the tubing as necessary. Next is to adjust the fit of the cannula as necessary. Tubing should be snug but not tight against the skin. And encourage the patient to breathe through the nose with the mouth closed, and reassess the patient's respiratory status including respiratory rate, effort, and lung sounds, and note any signs of respiratory distress such as tachypnea, nasal flaring, use of accessory muscles or dyspnea. And next is to remove the PPEs if used and perform hand hygiene, then document. Put on clean gloves and remove and clean the cannula, and assess the nares at least every 8 hours or according to agency policy. Next is to check the nares for evidence of irritation or bleeding. Good day, sir. I am Ricardo Pascual, a student nurse of NUSD, and may I know your name? Okay, Mr. Chopper. Mr. Chopper, I will be your student nurse from 8 a.m. to 12 noon. And what I am about to do to you is I'll be putting on a nasal cannula on you so you can breathe more comfortably. Sir, please. So I'm going to check your nose. Would that be alright? The nose seems to be clean. And I need to put sterile water in the oxygen machine. Nasal cannula is connected, and there's oxygen coming out from the prongs. Now I'll be connecting this, and there's oxygen coming out of the prongs. And now, sir, I'll be putting it in you. Sir, please breathe in through your nose while your mouth is closed, okay? So that you can inhale as much oxygen as needed of your body. Next is to put on the sign of no smoking. Because smoking cigarette is very dangerous while oxygen is near, or any form of oxygen tanks, because it might explode. And next is we'll be reassessing your oxygen saturation. It's still low, but maybe we can reassess later.